Hi, I'm Dana Eisinger. I'm your skilled home care account executive with Elara Caring Home Care. And I wanted to come and talk to you today just a little bit about sepsis, some statistics, and the partnership that we have formed, and also things that our clinicians are doing to monitor patients for sepsis. So, what is sepsis? Sepsis is a body's life threatening response to an infection. Over 1.7 million are affected individually every year, and over a quarter of a million people pass away because of sepsis in the United States every year. Studies are also showing that sepsis is the leading, if not number one, fatal complication of patients with COVID 19. So, from a skilled home care side, that's very important to us because if a patient discharges from the hospital, or even if they never were at the hospital but develop COVID 19 at home and we're providing care for them, we want to make sure that we are aware of the signs and symptoms of sepsis to make sure that we get treatment to those patients right away. One statistic that has been found is that the risk of dying from sepsis increases 8% every hour that treatment is delayed. So, again, why it's so important for us to make sure that we're monitoring those patients, for signs and symptoms of sepsis. So, Elara Caring has entered into a collaboration with the Sepsis Alliance, and we are the only known company that has this collaboration, home care company that has this collaboration with the Sepsis Alliance. So our clinicians have received special training, and we are monitoring and screening every patient when we enter their home for signs and symptoms of sepsis. So what are those signs and symptoms? We use the acronym TIME. T for temperature. Is it higher or lower than normal? I for infection. Do they have any signs or symptoms of infection? M for mental decline. Are they confused, sleepy, difficult to arouse? E for extremely ill. Are they having severe pain, discomfort, or shortness of breath? Based on that screening tool, the clinician has a specific pathway, clinical pathway that they follow that leads them down a timeline of exactly what they need to do to make sure that we get that patient the care that's needed. So again, I want to stress that we use this screening tool with all of our patients, no matter what their initial diagnosis is, because we do want to make sure that patients are being screened for any signs and symptoms of sepsis because we know how important that diagnosis is. So I want to thank you for taking time to listen to me today. I appreciate your partnership. I will have my contact information down here as well. If you have any questions, I'd love for you to follow up with me. Take care and have a great day.